This is about single stage multi-level surgery concept for cerebral palsy. There are many orthopedic surgeons who delay surgical intervention for cerebral palsy cases because the CNS development and gut development matures by 7 to 8 years, and they postpone any surgery and they do all the surgeries at one or two go at these 7 to 8 years of age, as against every single happy birthday events, which also is referred as birthday syndrome. Now, a few things about it, that SEMLS, that is single event multi-level surgery, is done at 7 to 8 years of age for diplegia cases of CP affecting hips, knees and ankles at one or two go. Now, diplegia means, di means two, plegia means both the lower limbs are affected and upper limbs are also affected. If only lower limbs are affected, it is paraplegia, which is not happening in CP. So diplegia, and it's always is there some spasticity. So something more about this CP, clinical aspect. Now clinically, how you will diagnose that is a case of cerebral palsy. There are different points mentioned here. And that is what was mentioned in the beginning, as against birthday syndrome, which is done every happy birthday event, which leads to correction of one deformity, leads to another exaggeration of another deformity. Like if you correct equinus by cutting the tendo Achilles, knee will be bent. And then to correct that, you cut the hamstring, hip will be bent, and so on. As against that, SEMLS is done to take care of all the aspects. Now, this is very important. Monoarticular muscles like iliacus, adductors, quadriceps, soleus are anti-gravity muscles and should not be cut. There should be sliding operation. Polyarticular muscles like psoas, gracilis, gastrocnemius are propellant. They can be cut, they can be lengthened. Hip adductor deformity, if adduction is limited to less than 20 degrees, then do surgery. Obturator neurotomy, 50% of anterior branch of obturator nerve is cut. Principles of SEMLS. Now, as mentioned, surgery for muscle spasm, muscle or tendon lengthening, is also a muscle weakening operation. Surgery for bone joint deformity correction to make the muscles more effective. Tendon transfer should be done. The tendon to be transferred should have power at least 4. Now, a very important point is that gastrocnemius and hamstring together, they pull the joint backwards and they effectively are extensors in the stance phase for the knee joint. So if you weaken any of them, the knee flexion deformity will get exaggerated. Now, The ossification centers for navicular and cuboid develop at 4 years of age. So tibialis anterior transfer should be done at or after 4 years of age. In CTEV, complete tibialis anterior transfer is done to cuboid. In CP, lateral half of tibialis anterior is transferred to cuboid. This is the summary that single event multi-level surgery is correcting all the deformities at ankle, knee, hip by taking bone muscle recession surgeries and bony surgeries 1 or 2 go.